The following segment is sponsored by Providence Health and Services.
A tigered woman living a healthy lifestyle, physically fit, apparently doing all the right things, goes into full cardiac arrest. But she's lucky, as she's one of the less than 10% who survive. And she's sharing her story to help other women take care of their own heart health and maybe help save lives. Steve Dunn reports.
I do like getting my story out there because I think people can relate to it.
April Frezza and her husband Nick loved their Sunday bike rides. Both their lives changed forever during one such ride back in 2012. It happened in an instant.
We crested the last hill before entering our neighborhood, and my husband always rides just a little bit further ahead than me, and so it wasn't unusual that he had already turned into the neighborhood. And he was thinking maybe I had mechanical issues or something, and came back, and was surrounded by the emergency responders.
By the time Nick reached his wife, she was in full cardiac arrest. A passerby was giving April CPR, which likely saved her life. Dr. Lori Tam is April's doctor at Providence Health.
She went into multi-organ failure after her cardiac arrest. Essentially, many of her organs shut down. She went into kidney failure, required dialysis. She developed GI bleeding and developed a condition where she had bleeding from multiple organs in the body. So she was just extremely ill because of the damage caused by the cardiac arrest, where she wasn't getting sufficient blood flow to her organs.
April spent months in the hospital in recovery. She fully recovered, which Dr. Tam says is rare. 90% of cardiac arrest victims don't survive. Of those who do, many have lasting neurological problems.
2 months in the hospital physically, a little bit over actually.
Looking back, April says the only possible early warning sign she experienced was a heart flutter 6 days before she collapsed. Dr. Tam says the warning signs in women can be difficult to detect.
It's probably because sometimes the symptoms are atypical and subtle. Sometimes it's because we have a lot going on in our lives and we're not necessarily paying as much attention to ourselves.
It's been 9 years since April's cardiac arrest. She hopes by telling her story, she'll inspire other women to put themselves first when it comes to their health.
And that's what I say when I do these types of speeches, is that I want people, women especially, to prioritize themselves and listen and investigate. It's obviously extremely important.
Doctors say the best way to obtain optimal heart health is to maintain an active lifestyle. Eat a well-balanced diet, including lean protein, vegetables, refrain from smoking, excessive alcohol use, and stay up to date on your routine health screenings.